Hello everyone, my name is Miko A. Solita and this is
Ryan Billones.
We're here to present our topic, Parkinson's disease.
Parkinson's disease is a progressive disease of the nervous system marked by tremor, muscle rigidity, and slow imprecise movement, chiefly affecting middle-aged and elderly people. It is associated with degeneration of the basal ganglia of the brain and a deficiency of the neurotransmitter called dopamine.
What exactly is Parkinson's disease? So, Parkinson's disease is a progressive, also a neurodegenerative disease. It was called progressive because it progresses and worsens over time. As we can see here, it's also a degenerative kind of disease. It degenerates neurons in the brain. Now, in Parkinson's disease, we actually see a loss of a particular kind of neuron, what we call dopamine neuron. And this dopamine neuron makes a signaling chemical, what we call dopamine, which is really important for us to make normal movements. And a lot of this kind of neuron, what we call dopamine, we can locate them here in substantia nigra, and it is here on the brain above the spinal cord. This part of the brain is called the midbrain, and if these neurons lost, there will be reduction amount of dopamine in the brain. Because there is a reduction of dopamine in the brain, that's when we start to see the main movement signs of Parkinson's disease.
So, hello guys, we're back again. So, Parkinson's disease, we do have is clinical features. So, what we call the TRAP, T-R-A-P. And first letter is letter T, which is the tremor, and this is the example of tremor. The next one is R, what we call rigidity. A is akinesia or bradykinesia, slow movements. And the last one is postural instability. If standing, the patient cannot maintain balance in one position.
And all these main movement signs together actually formed a symptom complex called Parkinsonism or Parkinsonian syndrome. So that means Parkinson's is a disease that causes Parkinsonism. Parkinson's disease also experiencing psychiatric problems such as depression, cognitive problems, also memory loss, and trouble with concentration, such as sense of smell, also sleeping patterns. Causes of Parkinson's disease is unknown, or what we call idiopathic. So these are risk factors of Parkinson's disease, which increases the chance of having the disease. First is exposure to some pesticide or cleaning chemicals. Another one is older age. When he got about to reach 60 years old, the risk of having a Parkinson's disease increases, and each year time passes by increases. Also history of concussion in the head as well. Next one is gender. I'm not sure yet, but as what I've researched, male is having a lot of greater chances of having this kind of disease. Last one is breathing in heavy metal particles. So maybe if you live in an industrial area where those may found in the air. So these are the risk factors of Parkinson's. As what you can see now is the treatment for Parkinson's disease. So first off, we do have medication. Medication is to replace and increase dopamine levels in the brain because remember, our dopamine producing neurons have degenerated during the disease. And for some patients, the medication works great. It may be all that they need to minimize their symptoms. But for most patients, after they have the disease for several years, the medication just doesn't really cut it anymore. So when this happens, they may have the surgery. So the surgery is to help deal with their symptoms, and the goal of surgery is to inactivate areas in the brain that are causing their movement problems, like the tremors and rigidity. If this had been applied, if the problem is managing the symptoms, it will lead to quality of life. Remember, Parkinson's disease is a progressive kind of disease. It will continue to develop. Ages from 60 to 65 is the average age will be tackled by this kind of disease. Rare cases is not just older people will be having this kind of disease. 5 to 10% is the ages of people less than 50 years of age. Early onset is what we called, as I mentioned earlier, is the genetic mutation.